Hi, my name is Dr. Mike Shi. I'm a physiatrist with Kaiser Permanente in Oregon. In this video, I'll talk about how to treat your neck pain and how to treat an irritated nerve in your neck. First of all, let's go over some red flags. These are signs that something more serious might be happening. Unexplained weight loss, fevers, chills, or night sweats, a history of cancer, severe neck pain that wakes you up every night for more than 3 months, weakness in your arm that wasn't there before, feeling off balance or unsteady on your feet, clumsiness in your hand or dropping things from your hand, loss of feeling in your arm or hand that keeps getting worse, trouble getting your urine to flow when it wasn't a problem before. If you have any of these red flags, please consult your primary care provider first. But as long as you don't have any red flags, here are 2 important take-home points. Point number 1, there is nothing seriously wrong with your neck. It is very, very unlikely that your neck pain is due to nerve damage, fracture, cancer, infection, or any other serious disease. Point number 2, most of your neck pain is under your control. This includes correct posture, specific exercises, good sleep, a moderate level of activity, and a confident frame of mind. So if there isn't anything seriously wrong with your neck, then why do you hurt? The answer is a combination of 2 factors, the spine and the brain. Let's first look at the spine. As we age, our spine ages as well. This happens to everyone, including those without neck pain. First, between the bones of the cervical spine, we have these flexible discs made of a jelly-like substance on the inside and tough fibers all around. But because of the long-term effects of gravity and motion, that jelly starts to seep into the fibers as early as our 30s, and the fibers can start to bulge. As the disc flattens out, the bone grows broader to absorb more pressure, resulting in bone spurs. This process is called degenerative disc disease, which simply means normal aging of the discs, which usually does not cause significant pain. At the same time, also due to decades of gravity and motion, we start to develop some arthritis, or arthropathy, in the facet joints toward the back of the neck, and they grow bone spurs as well. These normal age-related changes can narrow the path for the nerves exiting the spine, which we call neuroforaminal stenosis. A mild or even moderate degree of facet joint arthritis or neuroforaminal stenosis can feel like stiffness or tingling, but rarely causes significant pain. How can that be? Well, the answer lies in the brain. While these changes are happening in the spine over time, the brain is constantly processing and adapting to information coming in from the body. As long as the conditions are right, our brain can continue to process and adapt, minimizing our pain and maximizing our function. For the brain to do a good job at this processing, we require good sleep, regular exercise, and a confident, positive frame of mind. As long as we provide our brain with these key conditions, it will automatically know what to do with the signals coming up from the aging spine and minimize any pain. This is why the vast majority of people with degenerative disc disease or facet arthritis experience little, if any, neck pain. Now, there are a few things our neck might experience that can cause pain. In our society, we spend a great deal of time with our head in front of our body, whether it's looking at our computer or driving, or we're looking down at our phone or whatever we're working on down here. Whereas we spend much less time looking up at the sky, climbing ladders or trees, or even just standing tall. And because of that imbalance, we end up overusing the muscles in the back of our neck simply to keep our head from falling further forward. In fact, for every inch of forward head positioning, the burden of these muscles increases by 10 to 15 pounds. And if we have our keyboard and mouse too far in front of our body, now we're overworking the upper trapezius and levator scapula muscles just to hold our arms out there. This goes beyond just the muscles. That forward head posture also puts unnecessary pressure on the front of the discs in our cervical spine, pushing the jelly backwards. After years and years of this imbalance, the jelly can weaken those posterior fibers, allowing some of that jelly to bulge. These disc bulges are not painful. However, continuing that imbalance of pressure may lead to a moment where some jelly leaks through, which we call a disc herniation. You may experience an intense aching pain at the base of the neck, right in the middle. If that jelly takes up too much space near a nerve and irritates it, the pain can radiate into the shoulder blade and down the arm. Keep in mind that an irritated nerve is usually not damaged, especially if you don't have any weakness or loss of feeling. It's simply telling you that something is in its space. If either of these situations describes your pain, do not try to stretch your neck out because this can aggravate the situation. Instead, if you need immediate relief, use a recliner, or if you don't have one, simulate a recliner by placing your chair against the wall, leaning your upper body backward, and letting your head rest back against a pillow. In addition to the muscles and discs, that forward head posture also ends up putting stress on the upper and mid cervical facet joints, which can then develop early arthritis. This causes pain about halfway between the midline and either side of the neck and can radiate up into the head or down into the trapezius. If those facet joints grow large enough over time, they can start to crowd out the nerve passing in front of the joint and give you pain, tingling, numbness, or even weakness in the arm. This arm pain will often feel worse when the arm is just hanging down and better if the arm is raised. So as you can see, just that head forward posture can create so many different problems. Meanwhile, certain postural muscles such as the deep neck flexors, lower trapezius, and thoracic paraspinals become chronically deconditioned, making it hard to break the habit. Therefore, a daily regimen of postural exercises to balance out our daily habits is crucial, regardless of whether your pain is from the muscles, the discs, the facet joints, or the nerves. When it comes to neutral posture, your head should be above, not in front of, the shoulders. Your earlobes, center of your shoulders, and center of your hips should all line up. This means undoing the forward curve in your upper back by tilting your chest toward the sky while relaxing your neck and maintaining your gaze forward. Now, we all have a tendency to revert back to forward head posture when we're busy, so I recommend getting up every 20 to 30 minutes to move around and reset your posture. For women, depending on your size, it may help to use a bra strap clip so that the bra straps don't pull your shoulders down and forward and your head along with it. Now, here are two simple exercises that will help you maintain proper posture. The first is called Brugger's relief position. From either a standing or sitting position, slightly lift your chest toward the sky, but keep your chin level to the ground and relaxed. With your elbows straight and palms open, rotate your palms and arms outward as you squeeze your shoulder blades together. Hold for at least 15 seconds while you take a few slow abdominal breaths. Repeat every 20 minutes while you're seated. The second exercise is called the chin tuck. Keeping your gaze forward, place 2 fingers on your chin and guide your chin directly backward. If you are keeping your chin level, you should feel a stretch or elongation in the back of your neck and pressure in your throat. Hold for 5 seconds, relax slightly, but not beyond your starting point, and repeat 5 to 10 times every hour. You might not feel much movement at first, but with time and practice, it will improve. If this is easy to do, you can pull your chin back without using your fingers, as if pulling away from something you want to avoid. This is strengthening the deep muscles in your neck to support the overworked muscles mentioned earlier. While doing the chin tuck, it's normal to feel some tightness behind the ears or at the base of the skull. If it causes pain in the sides of the neck, then use armrests and perhaps some additional pillows to support your elbows. If you find the chin tuck hard to do at first, it's okay to try it lying down so the muscles are more relaxed. You can even rest your hands above your head. Keep your gaze toward the ceiling and pull your entire head, including your chin, backward into the ground. You should feel a stretch or elongation of the back of your neck and pressure into your throat. Hold for 5 seconds, breathe, relax, and repeat 5 to 10 times every hour. If needed, you can put a thin pillow under your head for comfort. If you find the chin tucks very easy to do, then add a neck extension in the middle of each rep to get more motion and strengthening out of this exercise. Pull your chin back and imagine trapping a tennis ball between your chin and your throat. While keeping that tennis ball there, tilt your whole head back a little, then return to the start position. At first, it may be helpful to support your head with one hand while guiding the chin with the other. You should feel a movement a little lower in the neck where your neck meets your shoulders. If you find that the chin tucks or neck extensions flare up your pain or cause your pain or numbness to travel further down the arm, you may still benefit from a modified version where you extend from the upper thoracic spine instead. Start sitting upright with your hands behind your head. Slowly lean back while arching your mid-back until you feel a stretch in the center of your chest. Hold briefly, then return to an upright position and repeat 5 to 10 times every hour. If your pain or numbness tends to radiate down the arm, over time these exercises should reduce the extent of those symptoms in your arm, and instead they should centralize your symptoms toward the spine. But if even the modified versions of these exercises cause your pain or numbness to travel further down your arm, or if your symptoms haven't centralized after a week of doing these exercises every day, please contact your doctor or physical therapist. One final note about posture. It's helpful for your neck to be supported as close to neutral as possible when you sleep. If you're a side sleeper, that means having enough support under your head, which usually means more than one pillow. One strategy is for the bottom pillow to be made of a cheap foam that maintains its shape, while the top pillow conforms to the shape of your head, such as buckwheat hulls or memory foam. You can place a small towel roll under your neck for additional support. Your neck should be a continuation of a straight line from your mid-back up to the top of your head. Ideally, you should be lying directly on your side so that your head isn't rotated relative to the body. If you sleep on your back, you may need a thinner or softer pillow, which again should conform to the shape of your head, and a small towel roll or cervical roll gently supporting the curve of your neck. So we've covered quite a bit on the spine. What about the brain? Studies have shown that the following things make it harder for you to improve your neck pain. First and foremost are incorrect beliefs about your pain. There are 3 main misconceptions that can get in your way. Number 1, physical activity will harm my neck. Quite the opposite is true. Movement is essential to keep your core muscles from getting weak and to train your brain to adapt to those changes in your spine. If you're afraid to move, you'll end up doing a lot worse in terms of neck pain. Number 2, there is something seriously wrong with my spine. The words we use are powerful in managing our pain experience. Studies have shown that simply getting an MRI of your spine and reading the results can actually increase your pain. To the layperson, technical words like degenerative disc disease or disc bulge create images of injury, undermining your confidence in your own body and your brain's ability to process and adapt to your body's signals. Again, as long as you don't have any of the red flag symptoms, you can be assured that there is no catastrophic problem with your spine. Number 3, my pain is out of my control. Quite the contrary, there are many things you can do to lessen your pain, such as the strategies we've covered in this video. There are a few other things that interfere with your brain's ability to adapt. Narcotics, also known as opioids or opiates. Examples include morphine, oxycodone, Percocet, Norco. These medications sabotage your brain's own pain-relieving mechanisms, such that in the long run, you end up with more pain than if you simply avoided these medications altogether. Sleep difficulties. The brain needs good sleep so it can adapt to new problems, and neck pain is no exception. However, certain sleep aids like benzodiazepines can alter your sleep architecture and make it harder for your brain to learn and adapt. Emotional trauma. Prior traumatic events can heighten the brain's response to pain. This is because traumatic memories are stored in the amygdala, which then enhances the function of the insula, the same part of the brain that makes you aware of pain. So what can you do to optimize your brain when it comes to neck pain? Avoid narcotics and benzodiazepines. Follow good sleep habits. This is called sleep hygiene, and you can find many websites about this online. Address the sources of trauma in your life. One technique is called pain reprocessing therapy. I recommend watching the documentary This Might Hurt for a glimpse into this powerful method. Remind yourself that millions of people have gotten their life back after an episode of neck pain, and that means so can you. It's important to let your body move. Aim for 10,000 steps a day. There are countless benefits from daily exercise in terms of your heart, your lungs, your muscles, your circulation, your mood, your endorphins, and especially helping your brain adapt to the changes in your spine. Finally, let's review the two main take-home points of this video. Point number 1, there is nothing seriously wrong with your neck. As long as you have none of the red flags mentioned in the beginning of this video, it is very, very unlikely that you have any nerve damage, fracture, cancer, infection, or any other serious disease in your spine. Point number 2, most of your neck pain is under your control. This includes specific exercises, correct posture, good sleep, a moderate amount of movement, and a healthy attitude. Thank you for your attention, and if you found this video helpful, please share this information with others. Have a great day.